to talk about is how we take what we're passionate about and then turn it into innovation. Innovation is never a single event. And unfortunately, too many people, in places I've worked, I'm sure in places you've worked, say, oh, after action report, fix this. And then you're asked all of a sudden the next day have a solution for that. It's not necessarily an innovation, that's just crisis management, right? So we need to think about innovation as being a series of events. Let me talk to you about our project. We work in disaster supply chains. My passion is, just like I said, is public health, making the public's health better, however I can do that, and that's sort of where I come at every project with. I never envisioned ending up looking at supply chains, but here I am. And when we think about disasters and supply chains, right, they're dynamic. Part of the problem is they're dynamic. They all of a sudden come together very quickly. They're not a structured, phased thing. There are many players, and many of those players are new to each other. The location and environment is not always perfectly known. Disasters evolve over time, or they happen in places we don't anticipate. And I love this about planning, I was one of the authors and implementers of the U.S. pandemic plan for influenza. And then we had H1N1 in 2009. But the first assumption in the plan we wrote was, it'll happen in Southeast Asia. Whoops. So right away, we were off, right? Because on April 23rd and 24th, we were sitting in DC and we got a call that said, we think we have the new next influenza pandemic, and it looks like it's an 8% case fatality rate coming out of Mexico. I mean, HHS, people were falling over. What is going on? We had to try to dissect and understand it, and very quickly we ramped up. But it was not perfectly known to us, and we were all of a sudden perplexed and challenged in an environment we didn't understand because we hadn't planned that way. There are secondary and tertiary effects of decisions that are made. Great example in Ebola was supplies were coming in, and I spent a lot of time in Sierra Leone studying that case, and as supplies were coming in via air, there was expectations about what was coming and landing each day, as I understand it. A decision was made by some of the flight crews that they would not land and do crew rest in country, because there was a real concern about being infected. So they would delay their landing and land in a different country, do crew rest there, fly in to Freetown, unload, and then fly out. Well, that created a delay that no one expected. So those consequences came from decisions made about concerns of the disease. Disaster supply chains, as we all know, are not funded, and we often have a delayed start time. So those are all the challenges that we had right out of the chute with a disaster supply chain. My group was funded by the Paul Allen Family Foundation. They had an Ebola program. They first did a series of workshops to understand what were the challenges, and then they put out a granting opportunity. The University of Minnesota won one of them, and they came to us and they said, we will give you this money. And remember now, I work at the Food Protection and Defense Institute, so I worry about protecting food supply chains. But I also am an infectious disease epidemiologist, which is my passion. So I sort of had two lives. So when they came to me and said, you're going to work with the World Food Program, I'm like, wait a minute, wrong project. I'm not doing my food job, I'm doing my pandemic job. And they said, and they are too. They're doing the logistics cluster. So we got to start learning about what does it mean for the log cluster to operate, how will they be deployed. So we partnered together, and our missions were these: feasibility of improved disaster supply chains, how would we make that happen, how could we implement it, what technology solutions could help us identify emerging disease, and dynamic supply chain capability. So I'm really glad I listened this morning, and that I say the same thing they said, because it would have been really embarrassing if I was wrong, right? So creativity equals thinking. To me, innovation means doing, that we are doing something that gets accepted. Now, the challenge we had, right, is we had all of these creative bubbles that we needed to create, but we had a lot of people who were stuck in the norm. This is how we do business, this is how we've always do business, and this is how we're going to continue to do business. So it was a little bit of a challenge, and we fought that our whole project. So I don't know that we ever have overcome that creativity bubble. Now, the other thing I want to recognize is that some people are we can all be creative, and we can all train and practice to be creative. I think some people, it comes to them more naturally. Others are super good implementers. So my skill set is that map of the US. My skill set is that if Amy's in California and my student Rahul is in Massachusetts, where will we meet in the middle? We'll meet in the middle at 12:37 on Tuesday, and we're gonna eat at Nikki's barbecue, right? I can do that math and figure that out. Like, that's just my skill set. To which some of my staff says, I don't get it. I did the calculations and sort of the processing of logistics in my mind. I had a lot of meetings that day, so I was going to fly, but he's a poor college student, so he was going to take the train on Friday and see a buddy along the way, and we were going to get there, and we picked that place because Yelp gave it a 5-star rating, and that's why we're eating at Nikki's barbecue. They're like, you left all those steps out. And so I realized I needed to partner my sort of logic and processing with their implementation skills, and that we all weren't good at the same thing. And so really finding people who are not necessarily like yourself was better for the innovative process. So the first thing we knew we had to do was listen and observe. And I'm going to talk about the case and show you some of the data. I mostly have it up there to demonstrate sort of how the case rolled out and how we integrated with people. So I'm happy to talk more about the data we found later if you like. So the first thing we had to do is we had to get our hands dirty. We went into Sierra Leone with World Food Program and started asking questions and trying to understand what was happening and just observe. We listened for 6 days. We didn't offer solutions. We didn't try to say this is how supply chains work in the academic world and on paper. We just listened, and we listened to all kinds of people who told us the different aspects. I know many of the room were involved in Ebola as well, so I'm happy to hear your stories as well. For me, it was fascinating to see the marketing campaign about how to educate in Sierra Leone about this. This is a picture of Port Loco. This was the logistics cluster's humanitarian hub. These are the mobile warehouses that were established and the manager on site. And then we observed and we continued to ask questions. So when we first said, tell us what worked. What was awesome about this? Tell us what was challenging about this. And if in a perfect world, what would you fix first? Or what would have the biggest impact? And we were brought to these things. This is a stat card. Everybody familiar with that, I'm sure, in this, right? I come from a world where I'm with technologists all the time. I showed them this picture and they're like, well, that's a silly thing. We have all this technology, and they're telling me that I can hold my cup at Starbucks and walk in, or my phone, and it says, Amy's here. Give her her grande latte, half calf, blah, 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 blah. And they said, why don't you just use things like that? And I said, but you don't understand the infrastructure of this world. And then we'd go to the humanitarians, we'd say, okay, you don't need to accept all this technology, but there are some small things we think we could try. And they said, oh, that's so futuristic. I hope that comes someday. And the space between the technologists and those on the ground was so huge. And what we realized really quickly is we could bridge that, and there were solutions that are, yes, today implementable, but they weren't fully implementable. So how do we take what we could use at Starbucks and put it into situations like this that were sustainable? The other thing is we realized there were some real problems with just low-tech things. And as I've talked to companies about this, they're like, oh, we need people to tell us this. Because I said, somebody needs to make a better cardboard box. Teams all day long just restacked pallets of supplies. And this isn't the first time we've seen it, because the boxes collapsed in the weather. got all kinds of I'm sure somebody at Princeton can figure this out. I don't know, tell Pallavi, put that on the to-do list, right? There were little innovations and big innovations that would really help some of these problems out in supply chains, because anything in these boxes, some of these things, not anything, some of them had to be destroyed for sanitary reasons. We also asked and said, we need to understand the challenges you face. So this is Sean Price. He's with WFP in the log cluster. And this was the airport manager who scheduled all of the offloading of the airplanes. It was so fun to come back with the two of them because they got to shake hands and hug. Nobody could touch each other during Ebola or have an emotional connection. And I even get misty about it now. Walking around that country with Sean, who had been there for five months, was amazing. He just hugged everybody. He was so excited to be there and say, my colleagues, I'm so glad I can be here in a safe zone and have a connection with you. We also learned a lot by just saying what worked, what didn't work, and what was your biggest challenges. Because decisions were made, because there were no commercial flights coming in, decisions were made that not everyone had to be notified if a plane landed. Well, this particular gentleman offloaded all the planes, so he unpacked them. He said, Amy, we put someone on a forklift, and we had them sleep there, and if the runway lights came on, then we knew that we had to unload something. That seems like a crazy, right? A crazy thing. And then we had to figure out what kind of equipment and who to call in, and then we didn't know whose stuff it was, so we just parked it on the runway. So our runway was just full of pallets of things until someone came to pick them up. There's got to be a better way, right? So how can we think about that? My favorite story from this particular gentleman is he said somebody sent ambulances, and he said, I don't think I can say all the words would be inappropriate that he used in that sentence, but he made some comment that they'd taken all the gas, they'd put the ambulances on pallets, they'd taken all the air out of the tires and removed all the gas. And they said, we need those now. And he said, it's going to take me 8 hours to unload that. I have 3 other planes of materials I'm unloading first that will only take me an hour. So all of those things, right, are, to me, small things that we have to think about how to innovate against. And then lastly, understand the context, right? So in Sierra Leone, the infrastructure is such that there were only really 4 main roads for us to get to some of our clinics. Part of the problem is we have a lot of loss of product in response situations. Either it's stolen or diverted, who knows what. But we had no infrastructure to track packages. Like, we can track a pallet of things and put an RFID tag on it, right? And track it. But once we break down that pallet and we're at a case of gloves, it's too expensive to put a tag on it. So what can we, and then how do we track it? And I said, well, there are solutions, there are technology solutions we can put on these boxes in Copenhagen when we co-pack, and then we can find things. And they said, Amy, nobody has time to be scanning all these things, even if you give them a reader. So we've gone back and said, how do you make a box talk without human intervention? Right? That's the innovation we're working on now, so that anywhere in Sierra Leone, you can figure out where that box is, and no human had to touch it or do anything. You may have to walk by it with a phone, but we're working on that. So then we really worked hard on collaboration. Again, the WFP Minnesota connection was already made. So we had very intentional collaborations, and I have to say we had some forced collaborations. And some of the forcing was good, and some of the forcing was challenging, and I'll talk more about that in a moment. Well, we had created this, we were funded to do this disaster project. There was also another group that had been created called the Global Pandemic Supply Chain Preparedness and Response Initiative. That is the most awful acronym and name of a working group ever. We were using all those words for all kinds of reasons, so they started calling it the GPSCPRI. I couldn't even track it. But this was a working group of UN organizations, companies, and then others. The problem with it were the others, there was no charter. So people came and people left, and then people were interested, and then people left, and then people brought a friend, and then nobody came. Like, it wasn't functional, right? It wasn't productive. But we had champions. So we had Earthrun Cousins from WFP at the time, who stood up and, man, I will follow that woman anywhere, and said, dang it, we have a problem and we're going to work on it, and I will do anything I can to help you work on it. Now go, get busy, right? And then we had Stan, his name will come to me in a minute. He's this from Henry Schein, medical supply company, Bergman, Stan Bergman. So the two of them, between UN and private sector, said, we are your champions, we will remove barriers, go get, right, that's awesome, let's work. We had a call to action to improve this. We ended up at the World Economic Forum. They gave us the sort of the cheerleading speech to go forth, and we had a direction, and it was sort of, the direction was, go north, go do something. Well, there's a whole lot of latitude and longitude in go north, so it was kind of helpful. All right, so here's the project, and then here's that initiative. There was a bridge in the middle. The WFP, he had retired. He was the Wolfgang Erbendiger, who was the logistics chief, was in both groups, right? So he was here, was no longer the, I don't know if it was chief or director.
He was the director of logistics.
Director of logistics. So he was here and he was on this project. So he started to merge these two. So there was some muddling that happened, which was okay, but it didn't help for clarity. And we'll get to that. And we said, now, as a group, if we're going to go forth and do good things, we need a vision. So we came up with this, again, like everybody does, really long, wordy vision. And I said, we need to have a quick speech. We need to deliver the right thing at the right time for the right person in the right amount. That's it. If we can do that, let's talk in plain language. We can read that. It takes me, I might be slow, about 5 minutes to process those words. It takes me about 10 seconds to know what I'm going to do here, right? So plain language. So the next thing we had to do was articulate challenges. These are known to you. This is what you want to tell donors and investors, right? It's really bad if this goes wrong. Fund us. And then we had 3 activities to sort of get at the right thing, right time, right place, right amount. And we were going to assess the supply chain, we were going to conduct some case studies, and then we were going to do some key informant interviews. Now, part of the reason we were doing this, because remember, we weren't just one group. We were not just the UN, we were not just the academics, and we were not just the private sector. It was all of us together. And so all of this work included everyone. Was it painful? Uh-huh. Was it necessary? Absolutely, because we got a breadth of data and knowledge that we would have never gotten if we would have just gone to the UN, or if we would have just gone to like DFID and USAID. So it was really important that we did it together. So when we assessed the supply chain, we wanted to find the vulnerabilities, especially for the Ebola situation. We had to get data, we wanted to map it, and we had some tools to do that and analyze it. This is where we got data from. What do you notice? No companies. Do any of these people make latex or rubber gloves? No. So I had no data. I could get no data from the companies about what they produce. Some of them said we're not sharing, but most of them we just didn't know how to get to it, right? So let me give you some examples. So this is the cereal, and I forget what the C is. It's the super cereal. Yeah. So this was part of the product that went in. We had USAID data and WFP. So these are manufacturing, there's a port. These represent the countries. I'm not sure why they picked a biohazard sign, but that was picked. And then we also had, right, regional or country WFP putting into the system because there was already cereal there. We could also map that spatially, so we could start looking at where there are vulnerabilities or deltas in the amount we produce. So we obviously had stuff in the region, but it wasn't enough. So then we had to start considering where else it was being made and how to quickly get it here. So this became a conversation about airlift versus cargo ship, right? Chlorine, for those involved, you know that was a big thing. So this is USAID. They had a product source from one manufacturer. So if that manufacturer didn't have any, they didn't ship any. It was transported via sea to Guinea and Sierra Leone. As I understand it, they just sent. There was no how much do you need. Oh, well, first, do you need? How much do you need, and at what time? That comes a problem later. This was the WHO data, and this was product moving in. Now, the one thing to note here when you do the analysis, this is the same manufacturer that USAID used. So all of a sudden, they just know they're selling. And when they're out, right? So you can see, maybe not for chlorine, but for other things, that could be a real problem when we have multiple people drawing down, and we'll see this throughout some other slides. This is yet another source of chlorine. So this came from the WHO. This was chlorine that came in kind. So it came in kind from countries. It came from other UN agencies, UNICEF. It came from NGOs, and it came from individual donors. That was just for Sierra Leone. So now I've got big aid organizations sending in. I have WHO procurement sending in, and then I have all these in-kind donations sending in. Did any of them know that the other was sending? No. So now all of a sudden we have oversent to Sierra Leone, and it's now a logistics problem in that country, I believe, still. Body bags, this is the USAID data. Oops, sorry. Here is it combined with the WHO data. Again, you'll see there was a single manufacturer used. Here's some pre-positioning. We also had UNICEF. Some stuff was coming in and being pre-positioned at the UNHRD. I think that's the one in Ghana. Wholesalers were sending directly in, and then governments in kind. So again, a lot of movement for a dynamic supply chain. Now this is all upstream. This is pushing into the country. So I feel like there are sort of two sets of problems that we need to work and innovate against. One, this upstream piece, getting it into country. And we're pretty good at that, right? We know how to move stuff around the world. I mean, WFP is really good at it. But it's when we get downstream that becomes somewhat more problematic. Here's what a downstream routes look like for body bags, coming in through the ports and then being shuttled either to the log cluster or maybe directly to WHO or to the ministries of health, or what all those flags represent. I think a really interesting case, and we got this from data that was just on an online relief site, was gloves. And so what you see for gloves, do people know where gloves are made? Malaysia. So, right. So if we really lose that supplier, we don't have gloves. A real concern I have is, what are the ingredients to make those gloves? So we're just talking about manufacturing out and having troubles there. Who's looking at the ingredients? I'm talking food. Who's looking at the raw materials that makes a glove? What if we change how we're going to deliver vaccine for yellow fever? What if we change the syringe? Do we have any companies that are willing and ready to change and make a new syringe? Do they have the raw ingredients to do that? I mean, we have to find some way to spend time there thinking about that part of the supply chain. We're thinking products made or can be searched. If we have no materials, we're not making anything. We have to spend some time there. That's another soapbox. Okay, so the interesting thing about gloves here, other than the Malaysia cocktail party trivia, is that these are the manufacturers. We had some wholesalers. Most of it was going to a holding facility. Red Cross, IFIRC got in, wholesalers. Those are individual buyers who were probably wanting to volunteer or donate, and they were drawing down on our global supply of gloves. I love people, and most of the time I say, thank God for good people. However, I'm really challenged when they enter the system and don't tell anyone else, and all of a sudden, these organizations, you all included, can't procure gloves because they think they're doing their humanitarian volunteer service, and it's uncoordinated. And I know you see this all the time. It happens in lots of places. So how do we do a better job, right? This whole project was about how do we better coordinate and share information. Once you have all this data, of course, you could look at quantity and timing of body bags. I think one challenge that we saw existed, again, lots of moving parts with Ebola responses. nobody was sort of crunching the numbers to one starting the train was slow, we all know that. But when do you stop the supply chain train, right? So here we had a shortage in October of 2014 in, this was body bags, right? So we've got a shortage here, which makes sense. This is number of deaths over body bags available. Here in Q2 of 2015, we've got 2,300 deaths, but we have 10,000 body bags. So at what point do we need to slow that down, and who's watching, right? And I don't think we've put enough people sort of in those places to do that, and it's really hard, right? How do we stop once the engine's started? How do you slow it down? The other thing we did is we said, what happened in the past? Is Ebola a one-time thing that we have to be worried about? So we said we need to look. How do supply chains move in the past? And so we said we need to pick different countries in different times and different diseases and really understand those challenges. So here are the ones we selected. And again, it's really good to be at a university because you have all kinds of labor that are really excited to work, and they're free. So we had great students working on that. Here's just the case study from Ebola. We had a demand signal problem where we didn't know sort of that reprogression of the epidemic and the evolution of need. So when it moved places, when it hopped sort of a geographic space we hadn't anticipated. This is a real challenge, lack of clarity on specific items and needed in standards. So those aren't just medical standards, those are also cultural standards. Do you guys remember the body bag scenario? Right, black body bags versus white body bags. We had poor coordination and information sharing really complicated the demand forecast. Because if I said, we have 15,000 body bags, and someone else said, there are 15,000 body bags, that became 30,000 body bags, even though it was the same 15,000 being represented twice. Regarding supply, we had no information on the global availability. So this is where companies came in and we said, how much do you have? And they said, we're not going to tell you. That's proprietary. Well, all of it is, I get part of your data is proprietary. Is it all? We had little information on public strategic reserves or adequacy of stocks. We had multiple responders, as I showed you, drawing down. Stockpiling was a problem. And then poor coordination and information sharing led to under and oversupply. So Liberia had a lot of some things and Sierra Leone did not, and vice versa, also with Guinea. And then transportation. So we had a lot of inaccessibility due to both trade and travel barriers. We had limited information upstream. Downstream challenges are everything you can imagine we've ever seen. Customs, fuel shortage, warehousing. And then we had weak logistics and telecoms infrastructure. That really hurt last mile delivery. So these were the highlights we came up with across all 10 case studies, is that it was difficult to determine what supplies were provided or needed in those specific quantities. So counting was a problem and estimating was a problem. This wide range of responders in every incident and the lack of knowledge, they were all putting something into the system, was really problematic. And then precursors like the political or economic instability, natural disasters, healthcare infrastructure, weather patterns all led to different types of disruptions. And then finally, responding to an outbreak of a disease in a never seen part of the world made it infinitely worse. So the last thing we did was key informant interviews with what we called supply chain players. So this was really getting at the responders that were in the UN, the NGOs, and then also talking to technologists and talking to companies that had medical supplies. And we came up with all of the concerns they had around these topics, and I'm happy to share these slides. I won't go through each, but we categorized them into where there were real challenges. And they highlighted things to us that we wouldn't have known, we would have not asked for in the past or would have not seen just in reporting. Generally, there was a willingness to share. That was the biggest finding. We'll share, the industry said, we'll share with you, not everything. We said, great, 75-25, maybe 50-50 rule. let's take what we can and get started. Let's just not be paralyzed by not having 100% of the data. If they're not going to share pricing data with us, fine. Will you just tell us that if we are approaching a pandemic or an emerging disease that's concerning, will you just tell us how much you'd be willing to give or donate or we could buy? That's what we need to start, and they're willing to do that. The ask for information needed to be truly limited to what we needed. Any new system that we were going to create, IT or otherwise, had to have some functionality in peacetime and not just during an emergency. And too often we felt like we heard this over and over again. You throw us solutions for disasters, we only turn them on once every how long? And then finally, information flows need to be two ways. The industry felt like they put information into the UN system and the UN system never provided anything back to them. There was some same dynamics with countries and NGOs. So that information has to be passed both ways. So we came up with a bunch of challenges, but in our innovation we said those challenges have to be matched with what could be the opportunity. So this is where our brainstorming came in. So what we talked about this morning, brainstorm 100 ideas and then converge and diverge and converge and diverge. And we went ahead and did that. And we did that. This is specific to technology platforms that we were going to create. And then we did one for institutional challenges as well. So we knew we were funded to do a technology solution, but technology doesn't function if the institute isn't going to accept it. So we had both of those challenge and opportunity graphs created. So the next thing we had to do was define our success. So we figured out what was the problem, where were the challenges, and we were going to come up with now what we wanted to do. That has to be in plain terms, right? We said if we can answer these 9 questions, and we didn't know how to answer them when we started. If we can answer, and I don't know if we can even answer all of them yet, if we can answer these 9 problems or 9 questions, we can declare success, that we've moved the needle forward, and they're in plain language. You can't dance around the answer. You have to, no kidding, be able to answer them. So we started to create and brainstorm and innovate and go. And I think this is one of my absolute favorite graphics about design. So much of people design, they're like, isn't this pretty? And the users are like, I love to run on a gravel path, right? It didn't matter that this was the design. They chose what they needed. You have to listen to the user. What are they going? It's right, innovation. What are they willing to accept? If you're going to design without their inclusion, then just stop, because then you're just spending money. Now, we were so thankful. I don't know how many people know, WFP has an innovation accelerator in Munich. So we got to hang out in Munich for a week. It was lovely. These are my colleagues from all of those countries, or all of those organizations. They call it the boot camp, and it feels like that because you work from. And then we asked a really important question and said, how much of this is already built? Let's not recreate the wheel. So what we realized is the University of Minnesota and WHO already had outbreak warning technology. And then I asked the question, I said, if only we could say how many gloves you need per patient with Ebola, some resource estimation tool. And I happened to be at Interpol in Lyon for a completely different reason, and somebody called me from Geneva and said, come to Geneva. I'm like, well, I'm an hour train ride away. I'll be there in 2 hours. So I headed over, and they're like, we found it. They had already built it in 2009 for H1N1. And then they didn't need it anymore, so they just put it in the closet. So we unearthed it, cleaned it up a bit, and now we have a supply chain estimation tool. We then said once we know that there's an outbreak, we can tell how many supplies we need. Then we need to figure out where those supplies are. So some might be commercially held, government stocks, or in the UNHRDs. We said, how do we build a dynamic supply chain, and how are we going to route it? Air, ocean, whatever. We had those tools were already built. And then finally, that last mile tracking. That one was not built. All of this was already created. So what our innovation had to be was how to stitch this together in a meaningful way. That saved us tons of time and money. So then we were asked to write your work, so we had to come up with a plan. So it started out as stickies. It turned to a Gantt chart with timing. And we then put ourselves to work, right? We were going to have, this is how we were going to meet. This is what the individual teams were going to do. And this is what the connected team was going to do. We didn't all live in the same country, but we mapped our work for the next 9 months. So when we get to solutions, we had a bunch of activities. Remember, there are still two groups. There's this IT group, and then there's this big sort of companies in the UN and all these extra people talking a lot. We held an awful lot of meetings I'll tell you about, but we also did things like said, what are the most critical items? We can't provide supplies for the whole world for everything, but what are the most critical items for the 10 diseases of concern that we're most worried about? And we came up with a list of 62 things. We said, okay, let's go figure out where those things are and then how we get access to them. We did some on-site assessments, we did case studies I shared, interviews, and we did some big data stuff. So this big working group, we met a lot, all over the world. The frustrating thing about that was the agendas were set, but we had no goals at the end of each meeting to get us from one meeting to the next. There weren't defined action steps. In my mind, it limited our progress forward, so we had to force it. Those were the list of critical items. I'm going sort of fast. We did come up with a couple things, though, which I think were really important. One was an institutional solution. I'll give you a couple of them, and this was process. The industry said is, we can help you with supplies in a disaster, but you need to tell us when a disaster is coming. And the WHO said, we can't. You know, they weren't willing to release that. As something's emerging, they said, we can't always tell you that. So the industry is saying, we will go get more raw materials to make you more gloves and syringes and rubber boots, all of those things, and we'll pay for that because we're going to eventually use those raw materials. But we need to know when to surge. So if you can say something is emerging, it's likely to go hot, we won't make all kinds of stuff, but we'll be prepared so that when you say surge, we're ready. We haven't figured out that problem yet. How do we warn and let the industry know that they should get ready? And to date, nobody's willing to sort of make that call. And that's an institutional barrier we have to overcome. We did put a process in place to start thinking about it. So when we're planning, there's no threat. And these are the things we should have already done, right? We know how to move stuff, we know what the list of items are, and we know who makes those things. We've got that done. On notice, who, or somebody has to say to the suppliers, what are the things we're going to need and what do we estimate? Where are the raw materials and do we have enough? When the pandemic is imminent, we'll do these things. And then the question is, does WFP with the log cluster become that entity? Unknown yet. And then when we're in a pandemic, then we're in full movement. So we've exercised this a couple times with scenarios. I think this is still the most critical. And here was the map of chaos for body bags. So this is nobody talking to each other. We now have a technology that allows people to talk together. We did do another exercise. It dang near killed me. It was 4 days, and we did it. Indonesia said, we'll do it. We'll be the country that does it, and they set up in their operations center. And then Geneva and Rome and Copenhagen were working, and I live in Minnesota. So that meant we slept for 2 hours every day to prep everything for the next event. It was a field exercise. It actually happened, sparked out of Indonesia, but we used the platforms and we moved and tracked product. The solution we have now, we call Crystal. What it does is it allows you to put, so here's the area where we have concern. They said, we want to estimate how many of which of those 62 items we need. That model was run by WHO. The numbers were put in, and it said for Indonesia, you need 87,000 gloves. I'm making it up, but what this many ibuprofen, et cetera, et cetera. So then an email goes out to all the industry partners and said, industry partners, we need this much stuff. Just tell us what you got and what you're willing to sell or donate. We're not procuring anything. We just want to know what the global capacity is. You can scrape the UNHRD data off the web. It's real time, so we have that data in there all the time and know the numbers. And then this, all the green boxes, those are companies who logged into the system based on the email and said, this is how much we have. We did that in 7 hours. We all of a sudden had a picture of global availability of things. We then could match and say how much of what thing was where. Again, this is where we have GS1 and specification is so important. Mass, surgical, flat, rectangular with folds. We need to get to that level to know what we're putting into the system for the clinicians. And once you put that filter on, it tells you where that exact product is and how much is there and how much they need. You can look at this off the map so that you can sort of move the icons around and start the routing process. I know I'm going to fly this load, this route to get to that airport. And then you can start adding all the information in there, and through an API or digital handshake, I can have DHL just tell me every time it moves where it went. They're good at that. We should just take their data, right? Here that is real time, so this is an actual package that was moving from, I think this came from Copenhagen in, and so once you click on this route, it gives you all the information, where it is, what's in it, and when it'll arrive. This is the delta for aprons, body bags, and Ringer lactate, so you can see this is how much Indonesia said they needed, this is how much we had in the system, or how much was reported, so we had to do a bigger call to say, we gotta go find more of this. And then you could scale back down into Indonesia and see where stuff was landing. The biggest issue here that Indonesia all of a sudden raised their hand, they saw all this stuff, exercise coming in. They said, we can't handle all of these shipments. We need to start having you move where you're dropping product supplies. So they were able to, having looked at this, say, wait, we need to manage better what's coming in, or tier it so we didn't get everything at once. And then this is just looking at some of the connection hubs. We do have some data, bad data in, bad data out. This is data about how cargo vessels typically move. They're bouncing all over Southeast Asia. This data was put in. It's not helpful to anyone. So we also, when you innovate, have to try and fail fast and then move on. This has now been removed. Our industry solution was to just know if something was going hot, is that we bring in a lot of data sets, and a lot of surveillance tools do it, but we bring in precursor. If I know every year that this much water in East Africa is going to create rift, then I can watch that seasonally in patterns, and I can start looking in media and notifications of other reporting to start building a case that something's happening. That then can be an emerging alert that the industry could watch and say, look, that looks like it's going hot. Nobody's notifying yet, but I should just start thinking about that. So how we do this is we take all kinds of data and then we code it into an ontology or a specification to organize it. That there's the time you have a case, there's the place, there are signs and symptoms, and then there's some epi that comes with it. And then there's some control measures that we can pick up in media. Media will talk about social behavior or trade restrictions or flights not going someplace. We can look at the response, and then we can look at any precursors. So again, back to rift, we know if there's so much water in East Africa in this season, we're going to see more rift in cattle than we would otherwise. So once we have that, we let the machine learning system go through and start identifying these things. It codes articles, and then you can map it, but here are the diseases on the day I took the screenshot it was looking at. It then goes through any piece of data I have and see where it's yellow. It starts coding it and putting it together. So then I could have 15 different pieces talking about, let's see, this one was hemorrhagic fever. If I have 15 different pieces from 15 different data sets, it says, hey human, we think we have a case here. You should look at it. And it starts to tell you earlier that something might be emerging. There's Yemen and cholera. We've done H7N9 in China. And so you can see how it codes all that data just to start telling you again, something's emerging. We're not confirming it in WHO terms, but something's happening. The other thing it will do is pattern matching. So if we've seen this pattern in the past, maybe it wasn't in China, it was somewhere else, but if that same pattern starts emerging, it'll say, hey human, we think there's a case of something here. And just so you know, in the last 10 years, we've seen the same pattern here and here and here, and this was the result. So, a way to fuse information. Yeah?
I was surprised not to see India on chikungunya and dengue.
It could have been just the time frame that I pulled the
Yeah.
data in, so that might have just been it. And again, I'm an epidemiologist, I'm super passionate about this. The log folks, not so super passionate about this, so they were much more interested in the supply chain work. I do feel like we have to get something to industry. If industry is willing to say, we'll help and acquire raw materials to surge when you tell us to surge, we have to give them information to do that, right? They're taking a step forward, we have to take a step forward and notify them that they should start considering. I'm not sure how that works out. Any other questions?